Preparing surgical tools for autoclave. In the doctor's office, there are different kinds of instruments used. But in my video, I'll be using the vaginal instruments to prepare for sterilization in an autoclave. But before doing anything else, you have to wash your hands and follow the hand hygiene washing technique. But in my case, I already did wash my hands. Now, before we proceed doing the autoclave, we have to prepare and assemble the required equipments. And we need the following. Sanitized instruments. So these are the instruments, the vaginal instruments that we're going to wrap in and sterilize to prepare in an autoclave. So this is the episiotomy scissors, the overweighted vaginal speculum, and our sharp curette. We also need the wrapping material or the sterilization wrap. Others call it CSR or autoclave paper, glue paper. Now we also need the sterilization indicator and 2x2 gauze. And I forgot to mention the autoclave tape, the autoclave tray, and of course our permanent marker that we'll be using for label later on. Place double ply autoclave paper on a clean flat surface. Place the 2 squares of wrapping material at an angle in front of you on the dry surface with one corner pointing directly toward you. Then collect inspected, dry, sanitized instruments that you should wrap for sterilization. Make sure it's examined and inspected for any defects. So place the vaginal instruments diagonally. So this is the episiotomy scissors, and open those instruments with hinges to be able to be thoroughly sanitized. Put gauze on sharp instrument to prevent puncture of the package or injury to the operator. Make sure to place steam indicator to the center of the pack to make sure that the autoclave is reaching the correct levels of heat and pressure to destroy all microorganisms. Bring bottom corner up and fold back a portion of it. This fold should be touched when a sterile package is open. Do it on the right side and then fold it as well. Repeat the process on the other side and the other. So we have to finish this fold. Now double wrap the now packed instruments in the same manner as before, using the second wrapping piece. Now tape the exposed point using autoclave tape.
If the instruments were not to be placed in the autoclave right away, wait to add a date to the package until you are ready to have it sterilized.
First, before
Also, it would be easier if to cut the autoclave tape before doing the wrapping.
So now that we already taped the exposed point, we have to label the tape with type of instrument, date, and your initial. So in my case, these are vaginal instruments, so I label it with vag and my initial. Alternatively,
what I'm trying to say is that alternatively, autoclave envelopes may be used. Included an indicator strip. If the envelope did not have a built-in indicator strip, label the package in the same way.
Our instruments are ready in the autoclave.